Seniors, beware. 9. Popular medications that can trigger rapid dementia. It is a sobering and truly alarming reality that in the span of time it takes to simply consume this crucial information, roughly 20 older adults in our communities will be confronted with the devastating news of a dementia diagnosis. This isn't a distant statistic. It translates to one individual every 66 seconds facing a profound and life-altering challenge to their cognitive future. What should truly seize your attention and provoke a deep sense of unease, however, is the unsettling possibility that the insidious root cause of this widespread cognitive decline might not be the inevitable march of time and aging itself. Instead, the silent culprit could be lurking innocuously within the confines of your very own medicine cabinet, a place where you've been conditioned to seek solace and solutions for your health. For years, perhaps even decades, you've received reassuring affirmations that these daily pills are not only safe and routine, but an essential cornerstone for maintaining your well-being. Yet, a burgeoning body of groundbreaking new research is now aggressively raising urgent, undeniable red flags, challenging these long-held assumptions with startling findings. It is an astonishing and deeply troubling fact that a staggering 99% of seniors are completely unaware that at least one of the medications they meticulously take every single day could be systematically shrinking vital memory centers within their brain by an alarming margin of over 28% in a mere 12 months. This is not a gradual, benign erosion, but a rapid, almost aggressive assault on the very core of one's intellect and identity. We urge you to let the profound implications of that statistic truly resonate for a moment. As Dr. Michael Kent, I recognize that this revelation sounds profoundly unsettling, even terrifying, but I must impress upon you from years of firsthand observation in my medical practice that I have witnessed this tragic scenario unfold far too many times. Patients, with an unwavering and often misplaced trust, adhere implicitly to their medication regimens, operating under the dangerous assumption that if a doctor prescribed it, it must inherently be harmless and beneficial. Meanwhile, the pharmaceutical industry, with a disturbing awareness of these devastating cognitive side effects spanning decades, has continued its relentless pursuit of profit, amassing billions of dollars from the sales of the very same drugs that are, with increasing scientific certainty, accelerating cognitive decline in millions of seniors across the nation. Indeed, a stark 2023 study, meticulously published in the esteemed journal Neurology and Aging Research, made a chilling discovery. One specific class of commonly prescribed medications dramatically increased dementia risk by an astounding 49% in seniors, and this severe impact manifested within just 2 short years of regular use. This isn't a marginal uptick in risk. It represents nearly half again the normal baseline risk of developing dementia, a revelation that should profoundly disturb every healthcare provider and patient alike. In the following critical information, I am compelled to reveal the 9 most dangerous medications currently triggering rapid memory loss and dementia in older adults, meticulously ranked from those commonly overlooked to those that are absolutely mind-destroying in their cognitive impact. And pay particular attention to number 3 on this list. It is a medication prescribed to millions of seniors for what appears to be a completely benign and harmless condition, yet it possesses the insidious capacity to shrink key memory centers in your brain, and you likely remain utterly unaware of its silent, destructive work right now. Before we plunge deeper into these vital details, I earnestly wish to hear directly from you. Please take a moment to share in the comments section below. What medications are you currently taking every single day? And have you perhaps experienced any sudden episodes of debilitating brain fog or perplexing, unexplained forgetfulness after initiating a new prescription? We are committed to reading every single comment, and our team will be replying with personalized insights tailored to your specific situation, offering a lifeline of understanding and guidance. Do not remain silent about this. Your willingness to speak up, to question, and to share your experience could quite literally save your mind or the mind of a loved one. Now, without any further delay, let us immediately begin with number 9, and please do not allow its position on this list to diminish its profound significance for a single second. This medication is presently nestled in the medicine cabinet of almost every senior household, a seemingly innocuous presence that could be silently scrambling your brain's intricate pathways long before you ever perceive the very first symptom. Number 9, diphenhydramine, Benadryl, is the familiar, often pink-hued pill that millions instinctively reach for, trusting it to usher in a night of restful sleep, quell the relentless assault of seasonal allergies, or alleviate the irritating symptoms of a common cold. It is celebrated for its affordability, its ubiquitous availability over the counter at virtually any drugstore, and in all likelihood, a bottle of it resides right this very moment in your nightstand drawer or bathroom cabinet, a testament to its widespread acceptance. You might genuinely believe you are merely utilizing it to enhance your sleep quality at night or to find relief from persistent allergy symptoms. However, unbeknownst to many, within the intricate architecture of your brain, Benadryl is actively and aggressively disrupting the crucial functions of your hippocampus. This specific delicate region is not merely a part of the brain, it is the veritable cornerstone responsible for the intricate processes of forming and meticulously storing new memories, the very essence of learning and recall. Benadryl and its many hidden forms belongs to a pervasive family of drugs known as anticholinergics, a classification that operates by systematically blocking the actions of a profoundly crucial neurotransmitter called acetylcholine. Acetylcholine is far more than just a chemical messenger. It is the indispensable conduit that empowers your brain to forge fresh memories, assimilate new information, and steadfastly maintain alertness and cognitive sharpness throughout the waking hours of the day. As the human brain naturally ages, it becomes progressively and increasingly reliant on every precious bit of acetylcholine it can organically produce. Therefore, when medications like Benadryl aggressively interfere with this exquisitely delicate and age-sensitive neurochemical process, the ensuing results can be nothing short of absolutely devastating. A compelling 2023 study, meticulously published in the Journal of Geriatric Cognitive Health, presented a stark warning. Seniors who habitually consumed anticholinergic drugs on a regular basis faced an alarming 54% higher risk of ultimately developing dementia when compared to their peers who wisely abstained from these specific medications entirely. This represents more than half again the normal risk, a staggering increase attributable solely to the regular intake of what the vast majority of people benignly consider to be a harmless, everyday sleep aid. So, how can you proactively safeguard your most precious memory, your cognitive vitality? The foremost and most imperative step is to assiduously avoid any product containing diphenhydramine, especially if its label conspicuously displays terms such as PM, nighttime, or allergy relief. These seemingly distinct products are, in essence, frequently just Benadryl cunningly masked under a different, more palatable name. Furthermore, if you are presently relying on diphenhydramine for allergy management, be assured that a new generation of far safer, non-sedating options are readily available, such as loratadine, which is widely recognized and sold under the brand name Claritin. These newer, advanced antihistamines are designed with a critical distinction. They do not readily traverse the delicate blood-brain barrier, making them dramatically safer for long-term use in the senior population. It is paramount to reiterate, never discontinue any prescribed medication abruptly without the explicit guidance of a medical professional. However, it is equally critical to disabuse yourself of the perilous assumption that an over-the-counter label automatically equates to safe for your brain. Number 8, proton pump inhibitors, Prilosec Nexium, emerge as the next medication of concern, often deceptively marketed as gentle and harmless for your digestive system. Yet, beneath this reassuring facade, they systematically interfere with the very nutrients your brain desperately requires to remain acutely sharp, vibrant, and healthy throughout your golden years. These medications, categorized as proton pump inhibitors, or PPIs for short, are specifically engineered to drastically reduce the production of stomach acid. Consequently, they are frequently and liberally prescribed for common ailments such as persistent heartburn, debilitating gastroesophageal reflux disease, GERD, and chronic acid reflux problems. Many seniors find themselves ensnared in a long-term dependency on these medications, sometimes for years, even stretching into decades, because their uncomfortable and often painful symptoms return with an immediate and vengeance-fueled intensity the moment they attempt to cease their intake. What is distressingly and rarely communicated to patients, however, is the insidious manner in which PPIs systematically sabotage the absorption of vitamin B12. Vitamin B12 is not merely a nutrient. It is an absolutely crucial, indispensable compound that actively protects delicate brain tissue, steadfastly supports optimal memory function, sharpens focus, and underpins mood stability, acting as a foundational pillar of cognitive and emotional well-being. In a truly groundbreaking and meticulously conducted study from 2016, published in the prestigious JAMA Neurology, researchers undertook an exhaustive examination of over 73,000 individuals aged 75 and older. Their startling discovery revealed that regular PPI users faced a substantial 44% increased risk of ultimately developing dementia when compared to individuals who wisely refrained from using these medications. The detrimental impact extends beyond simply diminishing stomach acid. By aggressively suppressing stomach acid far too zealously, PPIs disrupt your body's innate and natural capacity to absorb not only the critical B12, but also other essential minerals such as magnesium and calcium. These minerals are not auxiliary. They are foundational to efficient neural transmission and proper brain cell signaling, acting as the very architects of neuronal communication. Without adequate, sustained levels of these vital nutrients, your neurons struggle immensely to fire efficiently, leading to frustrating misfiring, profound confusion, and disturbing memory lapses that often bear an uncanny resemblance to, and are frequently mistaken for, the early, ominous warning signs of Alzheimer's disease. But the insidious problem of PPIs delves even deeper than mere nutrient depletion. Scientific investigations have unequivocally demonstrated that PPIs also contribute to an alarming increase in the levels of amyloid beta plaques within the brain. These are not benign proteins. They are toxic, actively disruptive agents that impair normal brain function and are widely recognized as one of the core primary drivers of Alzheimer's disease progression. The excellent news, however, is that much safer and equally effective alternatives are readily available. If you are presently consuming a PPI every single day, it is imperative to initiate a candid conversation with your doctor to explore whether you can gradually and safely taper off, perhaps with the supportive assistance of H2 blockers like famotidine, which is commercially known as Pepcid. While H2 blockers are not entirely without considerations, they are significantly less likely to interfere with delicate cognitive function. Additionally, the simple act of chewing a piece of deglycyrrhizinated licorice, DGL, a natural compound renowned for its ability to coat and soothe your stomach lining, can offer substantial symptomatic relief without inflicting any cognitive harm whatsoever. Number 7. Bladder control medications, oxybutynin, ditropan, is next on our list, a medication frequently prescribed for uncomfortable bladder control issues, yet it may, in reality, be wreaking absolute havoc on both your immediate short-term memory and the delicate equilibrium of your emotional balance. Oxybutynin, widely recognized and sold under the brand name Detrapan, is a common prescription for seniors grappling with the distressing challenges of urinary incontinence or persistent overactive bladder problems. On the surface, this medication appears to be an eminently practical and genuinely helpful solution. Understandably, no one desires to contend with the profound embarrassment or the profound inconvenience of frequent, urgent bathroom trips that disrupt their daily life and diminish their quality of existence. However, the mechanism by which this medication achieves its effects is profoundly concerning. It works by directly blocking acetylcholine, which is the exact same critical brain chemical that is so severely disrupted by medications like Benadryl. And in stark contrast to some of the milder anticholinergic medications, oxybutynin possesses a particularly dangerous characteristic. It crosses the delicate blood-brain barrier with remarkable ease and directly impacts memory regions within your hippocampus. This particular characteristic makes it extraordinarily dangerous for seniors, especially when its use is prolonged over extended periods of time. A comprehensive and authoritative 2019 study, meticulously published in the British Medical Journal, unveiled a troubling discovery. Individuals over the age of 65 who regularly took strong anticholinergic medications, such as oxybutynin, for more than 1 full year, experienced a substantial 49% higher risk of eventually developing dementia. This staggering statistic translates to nearly 1 in every 2 users, a truly alarming rate. What renders this finding even more deeply concerning is the fact that the vast majority of seniors are never adequately or properly warned about these profoundly serious cognitive side effects. They are simply assured that the medication will assist in controlling their bladder issues, not that it may be actively accelerating their mental decline with every single dose they consume. The cognitive harm inflicted by such medications is, tragically, often misattributed to the natural process of normal aging. Patients commonly articulate feelings of being perpetually mentally foggy, experiencing frustrating difficulty remembering important appointments, constantly misplacing cherished everyday items, or suddenly struggling to coherently follow and keep track of simple conversations. This cascade of cognitive impairments is rarely, if ever, connected back to the insidious influence of the medication until significant, often irreversible damage has already been permitted to occur. Therefore, if you are currently taking oxybutynin and have detected any mental changes whatsoever, understand that these experiences are not merely in your head, and you absolutely do not have to endure continued reliance on this particular drug to maintain adequate bladder control. Fortunately, much newer and far safer medications are now available, such as mirabegron, which is sold under the brand name Mirbatrig. This innovative medication operates through a completely different physiological mechanism within your body and has consistently demonstrated a significantly lesser impact on vital memory function. These newer pharmacological agents do not block acetylcholine at all and are, generally speaking, considered substantially safer options for older adults who require reliable bladder control support without compromising their precious cognitive health. Number 6, statins. Rank among the most widely prescribed drugs in the entire world, their usage particularly prevalent among individuals over 60 years of age. Their primary medical intention is to effectively lower harmful cholesterol levels and, in doing so, reduce your statistically measured risk of experiencing debilitating heart attacks and strokes. Simvastatin and atorvastatin, commonly sold under the prominent brand names Zocor and Lipitor, respectively, represent the 2 most frequently prescribed versions of these lipid-lowering medications. But here is where a profound and serious problem begins to unfold, one that is often overlooked in the conventional medical discourse. Cholesterol is not merely a concern relegated solely to heart health. It is, in fact, an absolute necessity, an indispensable component component for optimal brain function. Your brain, that marvel of biological engineering, is astonishingly composed of nearly 60% fat. And within this fatty composition, cholesterol plays an unequivocally critical role in the intricate processes of creating and diligently maintaining the myelin sheath. The myelin sheath is a vital protective coating, akin to the insulation around electrical wires, that crucially assists nerve signals in traveling smoothly, efficiently, and rapidly throughout the vast neural network of your brain. When you aggressively and systematically lower cholesterol with potent pharmaceutical medications, you may inadvertently be starving your brain of the precise and essential material it fundamentally needs to function properly, to sustain its intricate cognitive operations. A compelling 2023 study, published in the esteemed journal Frontiers in Aging Neuroscience, presented a concerning finding. Researchers observed that seniors over 70 who had been diligently taking statins for more than 3 consecutive years experienced a significant 26% higher risk of developing mild cognitive impairment, MCI. Moreover, those who were prescribed and consumed high-dose statins exhibited even more pronounced and noticeable declines in their overall mental function. What makes this revelation even more profoundly alarming is the anecdotal evidence from some patients who have reported sudden and frightening onset memory loss, describing terrifying moments where they found themselves utterly unable to recall familiar names, recent conversations they had just engaged in, or even established driving routes they had navigated effortlessly for years. Now, it is absolutely paramount to fully comprehend that not all statins exert an equivalent effect on the brain. Certain medications within the statin class, such as pravastatin and rosuvastatin, do not traverse the delicate blood-brain barrier as readily as others and are consequently considered significantly less risky in terms of their potential cognitive side effects if you have been on a statin medication for an extended period, perhaps for many years, and you are now beginning to notice a persistent mental fog, an increasing tendency towards forgetfulness, or a growing sense of confusion. It might be an opportune and critical moment to initiate a serious, candid conversation with your doctor. This discussion should explore the possibilities of either a dose reduction, a reassessment of your current statin, or the proactive exploration of an alternative, perhaps more brain-friendly cholesterol management strategy. Do not postpone this vital conversation until potential damage becomes irreversible. The earlier you take decisive and informed action, the better your chances of comprehensively protecting your invaluable mind for all the precious years that lie ahead. Number 5, benzodiazepines encompass a group of commonly prescribed drugs, including lorazepam, often known as Ativan, diazepam, familiarly recognized as Valium, and alprazolam, widely marketed as Xanax. These represent some of the most extensively prescribed medications across America, primarily utilized for the management of anxiety disorders and persistent sleep problems. Their therapeutic action involves enhancing the effects of GABA, which is your brain's natural calming chemical, adept at reducing neuronal overstimulation and mitigating nervous system hyperactivity. Initially, when patients begin taking them, these medications often appear to be nothing short of absolute lifesavers. They possess the immediate capacity to quiet racing thoughts, effectively ease the debilitating grip of panic attacks, and facilitate the elusive process of falling asleep at night. However, a darker, more insidious transformation occurs over time. These drugs evolve into something entirely different, something far more sinister. They gradually morph into a trap, a dependency from which escape becomes increasingly arduous. A concerning 2022 study, rigorously published in the British Medical Journal, meticulously followed over 8,000 seniors over a significant 6-year period. Their findings were stark. Those who had used benzodiazepines for more than 3 months faced a substantial 51% increased risk of ultimately developing Alzheimer's disease. The risk profile escalated even higher for long-acting benzodiazepines like diazepam, which persist in your body for significantly longer durations and accumulate disproportionately in fatty tissues, including, crucially, your delicate brain tissue. What transpires within the brain is a form of chemical sedation, a progressive and systematic slowing down of neural activity across the entire cerebral cortex. This means that your brain gradually loses its innate capacity to assimilate and learn new information as quickly or efficiently as it should. It becomes markedly less flexible, demonstrably less efficient in its cognitive processing, and increasingly prone to profound confusion, disturbing memory gaps, and an unsettling emotional numbness. Seniors who regularly consume benzodiazepines often articulate a consistent and distressing experience. They describe feeling as though they are moving through a perpetual dense fog, a pervasive sense of being disconnected from reality, or simply a disquieting feeling of not being themselves anymore. And the absolute worst, most agonizing aspect of this situation arises when they attempt to cease taking the medication. Withdrawal symptoms, which can manifest as severe anxiety, intense agitation, and debilitating insomnia, can be absolutely brutal, creating a cruel paradox where the drug feels absolutely essential for survival, when in truth it is often the primary source of the very problems it was initially prescribed to alleviate. To address and correct this dangerous and pervasive situation, here is the precise course of action you need to undertake. If you have been consistently taking a benzodiazepine for more than a few weeks, it is absolutely imperative that you do not stop suddenly under any circumstances whatsoever. Abrupt discontinuation can be genuinely dangerous, triggering severe withdrawal, and in extreme cases, even life-threatening. Instead, you must work in close collaboration with a knowledgeable and compassionate doctor to very gradually and systematically taper the dose down over a period of weeks or even many months. Safer alternatives exist, such as buspirone, which is a non-sedating anti-anxiety medication, or the highly effective cognitive behavioral therapy, CBT, specifically designed to address chronic insomnia and anxiety disorders. These interventions can significantly help restore a sense of calm and peace without precipitating progressive memory loss and cognitive decline, offering a path to wellness without sacrificing mental acuity. Number 4, amitriptyline, Elavil, sold under the brand name Elavil, is an older generation tricyclic antidepressant that remains, surprisingly, quite commonly prescribed even today for a diverse range of conditions, including chronic pain, persistent insomnia, and sometimes even for the prevention of debilitating migraines. At first glance, its versatility might lead one to perceive it as a miraculous, multi-use pill that conveniently resolves several problems simultaneously. However, beneath this seemingly beneficial surface, amitriptyline is, in reality, one of the most potent anticholinergic medications still in widespread circulation today. This means that it powerfully and aggressively blocks the crucial action of acetylcholine, the vital chemical messenger that enables neurons to communicate effectively with each other, facilitates the intricate formation of new memories, and helps maintain mental sharpness and cognitive agility. In fact, its capacity to block acetylcholine is so robust and pronounced that cognitive effects are not merely possible side effects. They are, regrettably, essentially expected consequences, particularly with long-term use. In a monumental 2015 study meticulously published in JAMA Internal Medicine, researchers undertook a careful and extensive examination of over 3,400 adults aged 65 and older. Their findings were alarming. Those who accumulated higher cumulative doses of anticholinergic medications, like amitriptyline, over a significant 10-year period, faced a staggering 54% greater chance of ultimately developing dementia. This is not merely a slight or negligible increase in risk. it represents more than half again the normal baseline risk of dementia, a figure that demands serious attention. What is truly terrifying about this situation is the widespread lack of awareness. The vast majority of these patients were never informed that this widely prescribed drug possessed the capacity to actively harm their memory function. They were often prescribed amitriptyline for conditions such as chronic sleep problems or nerve pain, and then, slowly and insidiously, they began to notice troubling changes: persistent short-term memory loss, frustrating word-finding difficulties, and an increasingly foggy, diminished concentration. It is important to emphasize that it does not even necessitate a high dose of amitriptyline to precipitate serious cognitive problems. Even low-dose amitriptyline, taken nightly over a period of several years, can initiate a slow, invisible erosion of brain power, a decline that occurs completely silently, often imperceptible until significant damage has accumulated. The harm unfolds without clear, immediate warning signs. There are no obvious symptoms at first, just a gradual, creeping decline that bears an uncanny resemblance to normal aging, yet is, in fact, a drug-induced cognitive impairment that could have been entirely prevented with proper awareness and alternative choices. Therefore, if you or a cherished loved one is currently taking amitriptyline, it is absolutely imperative to speak with your physician immediately about exploring safer alternatives. For the management of nerve pain, options such as duloxetine or gabapentin may offer equivalent and effective relief without carrying the same severe anticholinergic burden on the brain. For persistent sleep problems, natural melatonin or very low-dose doxepin, which exhibits a much milder anticholinergic profile, can be utilized instead with significantly less risk to cognitive function. And for crucial mood support, a newer generation of antidepressants is readily available, such as sertraline or escitalopram, which are generally considered dramatically safer for long-term brain health and cognitive preservation. Number 3, paroxetine, Paxil, is next on our list, sold under the brand name Paxil, and stands as one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, widely used for the treatment of depression and anxiety disorders. At first glance, it presents itself as a modern, sophisticated antidepressant, one that is ostensibly designed to be gentler and safer than the older generation of psychiatric drugs. However, here lies the critical piece of information they rarely disclose to you. Paroxetine holds a unique and concerning distinction. It is the only SSRI medication that possesses significant anticholinergic properties. This crucial detail means it actively interferes with acetylcholine in your brain, setting it drastically and fundamentally apart from its SSRI siblings, such as sertraline or escitalopram, which do not share this dangerous characteristic. In a comprehensive and large-scale 2021 review, meticulously published in Frontiers in Psychiatry, researchers delved deep into the cognitive profiles of elderly patients who were taking various SSRI antidepressants. Their findings were stark. Paroxetine users exhibited measurable declines in short-term memory, verbal recall ability, and overall attention span within just the first 12 months of treatment, indicating a rapid and discernible impact on cognitive function. The study further unveiled that seniors consuming paroxetine were 30% more likely to manifest early warning signs of cognitive impairment when compared to those taking other common antidepressants. The cruel irony inherent in this situation is that paroxetine is frequently prescribed with the explicit intention of stabilizing mood and alleviating anxiety. Yet, its insidious anticholinergic action systematically undermines mental clarity and emotional regulation over time, ultimately defeating its own therapeutic purpose and potentially exacerbating the very conditions it seeks to treat through a different cognitive pathway. The solution to this dangerous scenario is straightforward, yet absolutely essential for the preservation of your brain health. It is strongly advised to avoid paroxetine entirely in the senior population. The authoritative American Geriatric Society has officially placed paroxetine on its Beers criteria list, which is a meticulously compiled and widely recognized compendium of medications that are deemed potentially inappropriate for older adults due to legitimate safety concerns, particularly regarding cognitive adverse effects. If you are currently taking this medication, it is imperative to initiate a conversation with your physician about the feasibility and safety of switching to much safer alternatives, such as sertraline or escitalopram. These alternatives are significantly better tolerated by the elderly and do not carry the same serious cognitive risks associated with paroxetine. Furthermore, supplementing with essential B vitamins, most notably vitamin B12 and B6, can provide natural support for mood regulation and may contribute to reducing your overall reliance on antidepressant medications, offering a holistic approach to mental well-being. Number 2, antipsychotics represent an especially alarming and profoundly disturbing category of medications, primarily because many seniors and their families often do not even realize they are consuming an antipsychotic drug. Medications such as quetiapine, known as Seroquel, risperidone, marketed as Risperdal, and olanzapine, sold as Zyprexa, were originally conceived, developed, and subsequently approved for the rigorous treatment of severe psychiatric conditions like debilitating schizophrenia and profound bipolar disorder. However, a deeply concerning trend has emerged. Today, these powerful drugs are frequently prescribed off-label to elderly patients for far more common issues such as general sleep problems, mild agitation, or simply behavioral changes that are associated with dementia itself. This means that drugs designed for severe, acute psychiatric illness are now being routinely and liberally employed in nursing homes and hospitals for seniors who are merely experiencing confusion, restlessness, or are deemed difficult to manage by staff rather than addressing underlying medical or environmental causes. The consequences of this widespread and often inappropriate practice are nothing short of absolutely devastating. A comprehensive 2022 study, meticulously published in The Lancet Healthy Longevity, meticulously followed more than 25,000 older adults and uncovered a chilling truth. Seniors who were prescribed antipsychotics for mere behavioral symptoms were an astounding 71% more likely to develop worsening cognitive decline within just 12 months, even if they had absolutely no prior history of dementia before commencing the medication. Even more tragically, these dangerous drugs dramatically escalate the risk of severe adverse events, including stroke, sudden cardiac death, and profound sedation. This level of sedation can directly lead to dangerous falls, necessitating emergency hospitalization or even permanent institutionalization in a nursing facility, thus accelerating the very decline they are ostensibly meant to mitigate. The underlying mechanism behind this damage is brutally direct and uncompromising. These medications aggressively suppress dopamine, a pivotal neurochemical that is not only intimately linked to mood regulation, motivation, and pleasure, but is also absolutely critical for high-level executive function and intricate memory processing within your brain. When dopamine levels precipitously crash, your brain becomes sluggish, perceptibly slow, and tragically unresponsive to external stimulation. This profound neurochemical suppression is precisely why seniors taking antipsychotics frequently appear dull, exhibit emotional flatness, or seem completely zombified. Their vibrant personalities seem to tragically fade away, and family members often find themselves grieving for someone who is still physically present but has become mentally and emotionally absent, a ghost of their former self. Correcting this tragic and pervasive situation begins with the courage to ask hard, direct, and uncomfortable questions. If you or a beloved family member is currently consuming one of these powerful medications, it is imperative to inquire of the prescribing doctor why. it was prescribed in the first place and whether its continued use is truly medically necessary for the patient's well-being or merely being utilized for the convenience of staff or caregivers. In the vast majority of cases, behavioral symptoms in older adults can be effectively and humanely managed with non-drug interventions. These include establishing structured and predictable daily routines, judiciously reducing environmental noise and sensory overstimulation, diligently addressing any underlying pain or physical discomfort the patient may be experiencing, and dramatically improving lighting conditions and promoting optimal sleep hygiene practices. When medications are absolutely deemed necessary, employing the lowest possible effective doses for the shortest possible durations can significantly mitigate harm and reduce adverse effects. But more often than not, these potent drugs are being deployed out of sheer convenience for caregiving staff, rather than stemming from a genuine, evidence-based medical necessity for the suffering patient. The profound tragedy is that many families are never fully informed about what these drugs actually do to the delicate brain. They simply observe their loved one rapidly declining, deteriorating before their eyes, without ever knowing that the true cause of this tragic decline is chemical, drug-induced, and therefore potentially avoidable, rather than an inevitable process of natural aging. Number 1. Anticholinergic polypharmacy is the hidden danger that almost nobody talks about, and it is genuinely one of the most significant and pervasive contributors to drug-induced dementia within the vulnerable elderly population. You may have anticipated a single, specific, particularly villainous drug to ultimately top this critical list. However, the most dangerous medication situation leading to rapid dementia in seniors isn't one solitary pill. It is the silent, insidious, and creeping cumulative effect of taking multiple medications, each possessing anticholinergic properties at the exact same time. This perilous scenario is what discerning medical professionals refer to as anticholinergic polypharmacy. To illustrate this all too common and frightening reality, consider this typical scenario. A senior seeking respite habitually takes diphenhydramine every night for sleep. Concurrently, they consume oxybutynin daily for persistent bladder control issues. And to manage chronic pain, they are also prescribed and regularly take amitriptyline. Each of these medications, when taken in isolation, might only induce mild, barely perceptible memory problems, perhaps dismissed as minor lapses. However, when these powerful drugs are consumed together, their individual anticholinergic effects compound exponentially, and the cumulative anticholinergic burden on your fragile brain absolutely skyrockets to dangerous levels. This is not merely a theoretical concern or an academic worry confined to medical journals. In a rigorous 2022 analysis, meticulously published in Age and Aging, researchers diligently tracked over 280,000 older adults. Their findings were stark and undeniable. Those individuals with the highest anticholinergic burden resulting from polypharmacy faced a staggering 120% increased risk of developing dementia within just 10 years. This represents more than double the normal baseline risk, a figure that should send shivers of concern through the entire healthcare system. And here lies the absolute worst and most heartbreaking aspect of this widespread problem. The vast majority of these seniors caught in this perilous web of polypharmacy had absolutely no idea they were even taking anticholinergic medications. Nobody had ever adequately explained this critical, life-altering information to them. When you systematically block acetylcholine from multiple different pharmacological angles simultaneously, your brain doesn't merely slow down temporarily or experience a transient fog. It begins an active process of decay and irreversible deterioration. Neurons, the fundamental building blocks of thought, physically wither from chronic underuse and neglect. Synapses, the vital communication points between neurons, shrink and ultimately disappear. Your entire brain enters a hypoactive, diminished state that, disturbingly, looks nearly identical to full-blown Alzheimer's disease on cognitive testing, leading to misdiagnosis and inappropriate treatment pathways. Correcting this profoundly dangerous and widespread situation does not demand a miraculous cure or exorbitantly expensive experimental treatment protocols. It simply requires a thorough, meticulous, and comprehensive medication review, a proactive and empowered engagement with your healthcare. You must urgently ask your doctor or pharmacist to meticulously evaluate your complete, exhaustive list of prescription medications, your over-the-counter drugs, and even any supplements you are consuming for their cumulative anticholinergic load. Modern online tools and professional software programs are now readily available that can precisely calculate your individual cumulative anticholinergic burden score, providing objective data. Once the problematic medications are precisely identified, you can then systematically work towards deprescribing, slowly and safely tapering off unnecessary medications, switching to significantly safer alternatives whenever medically possible, and proactively rebalancing your brain chemistry naturally, allowing its inherent healing mechanisms to assert themselves. This, frankly, is the most empowering and hopeful part of this entire video. Drug-induced dementia is, very often, remarkably reversible when identified and addressed early enough. When the oppressive medication burden is judiciously lifted and removed, many seniors experience a dramatic and inspiring regaining of mental clarity, a resurgence of physical energy, and a significant restoration of memory function, often within just weeks or months of discontinuing the problematic drugs. Your brain is a remarkably resilient and astonishingly capable organ, possessing an innate capacity for healing, but only if you provide it a real, unhindered chance by diligently removing what is actively harming it. Polypharmacy, particularly anticholinergic polypharmacy, is not merely dangerous and profoundly harmful. It is, in its essence, completely preventable, and that undeniable fact makes it the #1 hidden medical threat to the precious minds of our entire aging population. Now, once again, I want to hear directly and honestly from you. Which of these 9 medications are you currently taking right now? Have you personally noticed any troubling brain fog, an increasing tendency towards forgetfulness, or any subtle yet concerning personality changes since starting a new medication? Are you truly willing to take the crucial step of talking to your doctor this week about comprehensively reviewing your complete medication list? Please share your experiences and your honest opinions with us in the comments section below. We genuinely want to hear from you, to understand your journey, and to offer support. Your story, your courage to speak up, could very well help another senior avoid falling into this same dangerous and often debilitating situation, providing a beacon of hope and knowledge. Thank you for taking the time to watch and truly understand this vital message. Remember, I am Dr. Michael Kent, and my unwavering commitment is to help you stay sharp, healthy, and strong for all the wonderful years that lie ahead.